CST Certification Practice Test 2026 30 questions explained. Certified Surgical Technologist. Question 1. Which of the following is the primary purpose of a surgical scrub? To sterilize the hands, to reduce the number of resident and transient microbes, to remove all dirt, to soften the skin. Scrubbing reduces microbial count but does not achieve sterility of the skin. Question 2. What is the correct order for the surgical count? Field, Mayo, back table, floor. Floor, field, back table, Mayo. Back table, Mayo, field. Mayo, field, back table. Counts start at the surgical field and move outward. Question 3. Which of the following is an example of a non-absorbable suture? Vicryl, silk, chromic gut, monocryl. Silk and proline are common non-absorbable sutures. Question 4. What is the standard timeout before surgery? Check the equipment, final verification of patient, site, and procedure, giving the surgeon coffee, starting the anesthesia. The timeout is a critical safety step to prevent wrong site surgery. Question 5. A hemorrhage during surgery is primarily managed by giving water, hemostats and cautery, waiting, removing the drapes. Clamping, hemostats, and cauterization are key for controlling bleeding. Question 6. Which instrument is used to grasp delicate tissue like bowel? Coker, Babcock, Alice, Backhouse. Babcock clamps are atraumatic and used for delicate structures. Question 7. What is aseptic technique? Cleaning the floor. Methods to prevent contamination of the sterile field. The use of antibiotics. Sterilizing the patient's room. Aseptic technique maintains the sterility of the surgical field. Question 8. What is the most common sterilization method for heat-stable items? Gas plasma, steam under pressure, autoclave, glutaraldehyde, dry heat. Steam sterilization is fast, effective, and economical. Question 9. The Mayo stand is used for storing extra drapes, immediate use instruments during surgery, anesthesia supplies, patient positioning. The Mayo stand holds frequently used instruments near the field. Question 10. Which member of the surgical team is non-sterile? Surgeon, surgical technologist, circulating nurse, surgical assistant. The circulator works outside the sterile field. Question 11. What is the purpose of a lap sponge? Cleaning the floor, absorbing large amounts of blood and fluids, dressing the wound, applying medication. Laparotomy sponges are large and highly absorbent. Question 12. A vascular clamp like a satin ski is used for bones, blood vessels, skin, bowel. Vascular clamps provide atraumatic occlusion of vessels. Question 13. Which blade fits a number 3 knife handle? Number 10, number 20, number 22, number 25. Blades 10, 11, 12, and 15 fit the number 3 handle. Question 14. What is dehiscence? Successful healing, partial or total separation of wound layers, infection, blood clot. Dehiscence is a surgical complication where a wound ruptures. Question 15. Which solution is used for skin prep? Normal saline, chlorhexidine gluconate, hydrogen peroxide, sterile water. Chlorhexidine and betadine are common skin antiseptics. Question 16. What is the purpose of an incision? To close a wound, to create an opening to access the surgical site, to drain fluid, to apply sutures. An incision is a cut made with a scalpel. Question 17. The neutral zone is used for resting, passing sharps to prevent injury, storing drapes, anesthesia. Hands-free passing of sharps occurs in the neutral zone. Question 18. What is traction in surgery? Pulling to provide exposure, closing the skin, counting sponges, cleaning drapes. Traction/retraction helps the surgeon see the target area. Question 19. A bovie is a common term for a suction tip, an electrosurgical unit, ESU, a type of suture, a retracting tool. Bovie is the brand name often used for the ESU used for cutting and coagulation. Question 20. What is STSR? Staff surgeon, surgical technologist in the scrub role, sterile tech standard surgical room. STSR stands for the technologist actively assisting the surgeon.